Good afternoon, everyone, and welcome to Fountain House's 16th Annual Symposium and Luncheon, The Anxiety Epidemic, New Research, New Insights. So every year since 2003, we have gathered here to talk about different types of mental illness and listen to top experts from the field. I look forward to this luncheon every year. These are illnesses that affect so many of us personally, as well as the population at large. 1 in 4 Americans have been diagnosed with some sort of mental illness. And it's an opportunity for us to be educated and enlightened. We are also here to support Fountain House, as you all know, and this is a signature Fountain House event. It was created by Fountain House volunteers, and its success is largely due to their efforts. And it's a dedicated team of co-chairs. Their names are on the program. I am delighted to introduce one of them, who is a key contributor to Fountain House. She's a Fountain House board member and a longtime co-chair of this symposium luncheon, Alexandra Herzan. So, Alex, please come and welcome her.
Thank you so much, Consuelo. Good afternoon. On behalf of my co-chairs, I'd like to thank you all for coming to the 16th Annual Fountain House Symposium and Luncheon, which has become the premier lay forum in New York City for the discussion of mental illness and Fountain House's most important fundraiser. For over 70 years, the Fountain House model has been the most successful and cost-effective program to empower people living with mental illness. You will see more about our newest initiatives in today's film and in your luncheon program, and also up there. I will now turn the microphone back over to Consuelo Mack, who we are pleased to have as our Master of Ceremonies again this year. Consuelo is the executive producer and anchor of Consuelo Mack Wealth Track, an expert in business television, and a dear and loyal friend of Fountain House. Thank you so much.
So thank you, Alex. We are so grateful to Alex and her co-chairs. And also, I've got to give a shout out to the founding chairs of this event, Lorna Hyde-Grave and my dear friend, Lynn Nicholas, for creating this symposium to help us understand mental illness, which affects, as I said, 1 in 4 Americans. And I know there are a lot of you who have been at this luncheon before, and I can tell by the crowd that there are some of you who are just joining, so you're in for a treat, because this helps all of us so much understand different aspects of mental illness. And anxiety disorders, it turns out, I don't think it surprises any of us, quite honestly, are the most common mental illness in the U.S., affecting 40 million adults, or 18.1% of the population every year, and 8% of children and teenagers. And the symptoms frequently start before the age of 21. Anxiety disorders, it turns out, this is the good news, are highly treatable. We're going to hear about that in a moment. Yet only 37% of those suffering from anxiety disorders actually receive treatment, and that's according to the Anxiety and Depression Association of America, which is a great resource. And frequently, it turns out that a co-disorder, a co-occurrence, is depression. So before I introduce the panel, we always like to get a sense of the room here, of how many of you have been affected by this disease. And so I'm going to ask you to raise your hands if you, a family member, an acquaintance, friend, have experienced an anxiety disorder. So I'm laughing because there is a reason that we are all here, and I am so grateful for our panelists who are going to help us understand anxiety disorders and also cope with them. So each is going to make a presentation, and then they're going to share their knowledge and their experience. Then I will have an opportunity to ask them some questions from a layperson's perspective. So blame me if I ask the wrong questions. And then we're going to wrap up the panelists' discussion just before luncheon is served, so you will have an opportunity to discuss what you're going to learn here in the next half hour which I know we're all looking forward to with our various table mates. So let me introduce the first panelist. If you look at your programs, there are extensive bios of each one of them, but I'm just going to give you a couple of the highlights. And I'm starting at the, your left, stage right. Sanjay Matthew, MD, is Vice Chair for Research, Professor of Psychiatry and Behavioral Sciences at the Baylor College of Medicine. He is a staff psychiatrist at Baylor's VA Medical Center. And before returning to his hometown of Houston in 2010 to take on those responsibilities, he was here in New York for many years at Mount Sinai, and he co-founded and directed the Mood and Anxiety Disorders program at Mount Sinai School of Medicine. And his research focuses specifically on developing novel therapies for patients with treatment-resistant mood and anxiety disorders and PTSD, including a new one, which is, he'll talk a little bit about, the FDA-approved antidepressant esketamine. So I'm looking forward to hearing from Sanjay Matthew. Marie Albano is PhD, Professor of Medical Psychology in Psychiatry at Columbia University. She's director of its Clinic for Anxiety and Related Disorders and clinical site director of New York-Presbyterian Youth Anxiety Center. Her focus of her work is in behavioral and cognitive therapies, and also she's won numerous awards for her book, which is You and Your Anxious Child. This is such a great title. Free your child from fears and worries and create a joyful family life. It is possible. And so she's going to help us do that. And I am grateful to report as well that she has referred many patients over the years to Fountain House. Scott Stossel is the national editor of The Atlantic. We talked about this. It used to be known as The Atlantic Monthly. That's how I knew it. But he said it's anything but a monthly now. It's doing a lot more publishing, much more frequently, daily. His articles and essays have been widely published in other leading publications, but the reason he is here is because of his bestseller, which is titled My Age of Anxiety, Fear, Hope, Dread, and the Search for Peace of Mind. He has walked the walk of serious anxiety since the age of 10, and he has brought his experiences and skills as a journalist and a wonderful writer. So I've started the book. I confess to him I've not finished it, but I will finish it. It is a really wonderful book. It's gotten rave reviews, and it's been published in 20 countries. So I'm going to start with Sanjay and ask them to come up here to lead us off with backgrounds on anxiety disorders and causes and treatments. So please welcome Sanjay Matthew.
Thank you, Consuelo, for that very kind introduction, and it's a real thrill to be here, and really a great thanks to all of you in the audience for your generous support of this incredible organization, and it's really a tribute to the leadership, including Ken, who I understand is soon to be retiring, and so really my greatest praise for all you do to support this outstanding work. So I'm a psychiatrist. I do research and I treat patients with anxiety and depression. I treat veterans at the Houston VA as part of my duties. And so what I'll be laying the groundwork for is a little bit about anxiety disorders, just what is the basics for each of the major ones, and then talk a little bit about our research and sort of the next steps in terms of drug development, which is an area that I focus on. As Consuelo mentioned, anxiety disorders are incredibly common. So lifetime prevalence is about 1 in 5 individuals, and it's something that strikes the young. So it often strikes teenagers, adolescents during these critical periods of time. And anxiety is a risk factor for developing other illnesses, depression, major depression, bipolar disorder, substance abuse. So the title of the program is The Anxiety Epidemic, but that epidemic really interfaces with 2 others that we're grappling with. One is the suicide epidemic, which, as we know, over the last 15, 20 years, there have been increase about 30, 35% of suicides in this country. while every other major medical illness, there have been decreases. We've done remarkable work with decreasing cancers. HIV essentially is a very treatable illness at this point, but suicide, we have not done much to decrease the numbers. So that's truly an epidemic. The other epidemic is the opiate epidemic. We have a number of 50,000 overdose deaths in the last year due to the opiate crisis. So how does anxiety serve as a trigger for some of these other problems, and how does it run with those other problems? That's an important area that we're investigating. And in terms of the overlap with all of this, at the VA, where I treat the veterans, 22 veterans die every single day from suicide. So more veterans die by their own hand than died in the wars in Iraq and Afghanistan. So these are really troubling statistics that part of our work is trying to address. So what are the major anxiety disorders? We have generalized anxiety disorder. That's a very common one, seen in about 5% of individuals. And these are patients who worry, and they worry a lot. They worry about minor matters. They worry about major matters, about finances, about their relationships. They ask the question, what if this happens? What if that happens? They cannot stop worrying. Now, how is that different? How do you become a disorder versus a person who lives in New York and deals with a lot of different things? And the difference is this is chronic. They wake up worrying, and it lasts many months, and it's disabling. They avoid engagements because of the worry. And it overlaps with depression. It morphs into depression. So you may have irritability, you may have insomnia, you may have concentration impairments. A lot of this looks like depression, and the treatments are often the same. So that's a common disorder, GAD, so-called GAD. The second one is social anxiety disorder, social phobia it's sometimes called. And some would refer to it as pathological shyness. People, when you ask the general person what is their single biggest fear, many of them would answer, my single biggest fear is giving a talk in front of strangers, in front of a big audience. So that's a form of social anxiety. That's a very specific one. But folks with social anxiety disorder, they avoid conversations with strangers. They avoid going to parties. They may be very good at their work, but they avoid promotions because having a promotion means I have to go on business trips. I have to give a talk in front of others, make a presentation. So it can be debilitating, and it ends up really impacting their life. And often they may drink. So there's a high comorbidity with alcoholism. We know that alcohol is a social lubricant. And for many, that's the only way they can face a party or some other engagement. Then there's panic disorder. And we all have heard about panic attacks. And we think of mental disorders as very psychological and mind-based. Panic attacks are very physical. So you have palpitations, you have shortness of breath, you have difficulty breathing, you have dizziness. I mean, you have a whole host of neurological and gastrointestinal symptoms that build up in this crescendo pattern over 10 minutes, and then you have a persistent fear of having more of these attacks. And you avoid places and people and things that may sort of trigger these attacks. And so these are out of the blue, unexpected, and can be very debilitating. And then finally, we have the phobias. And so there's the height phobias, there's the fear of flying phobias, there's the blood, there's needle phobias, you name it, there's a phobia. And it's the good news about phobias from a treatment perspective is with good sort of psychotherapies, cognitive behavioral therapies, exposure therapies, these are very treatable in most cases. So where are we going with respect to understanding the causes of anxiety? Clearly, it's multifactorial. It's a combination of genetic vulnerability with environmental factors. And in terms of drug development, most of the drugs that are approved for anxiety disorders were stolen from the depression world. So these were all antidepressants, such as Prozac, Zoloft, Lexapro, et cetera, that were then brought over to treat anxiety. So there was nothing specific that was about treating the anxiety with their serotonin drug, for instance, versus depression. So the problem with that is serotonin only explains a very small proportion of what's going on in the brain and comprises a very small, relatively isolated network. What we and many other programs have been studying are other systems, realizing that what's wrong in anxiety and depression, for that matter, is dysfunctional brain circuits. Circuits are offline. The prefrontal cortex is not talking to the more primitive parts of the brain, the fear centers, such as the amygdala and the hippocampus. And so if there's a way that you can enhance this connectivity or connections among these regions, that would be helpful. So SSRIs do that, but they do that in a relatively slow manner. It may take 4, 6, 8, 12 weeks to work. What we've been working on, and what Consuelo mentioned, is something like ketamine, which is a drug that impacts a fundamentally different circuit and different system in the brain called glutamate. You can think of glutamate as the major thoroughfare in the brain, and it's important for connections. What ketamine does, it blocks a specific glutamate receptor, which then leads to enhancement of connections from one region to another. And this happens in a very fast manner. So rather than waiting 8, 12 weeks for something to happen, you can know immediately. You can know within a couple hours. And recently, the FDA approved a spray version of ketamine. Should be mentioned, ketamine, you may probably have heard of it as Special K, or something that kids may abuse. And how do they abuse ketamine? They steal it from veterinarians' offices, where ketamine's used as a tranquilizer for our cats, our dogs, our horses, etc. And so it is a potential drug of abuse, but when used in a spray format under medical supervision, it could be a life-saving approach for serious depression, and that's what it's FDA approved for. So a lot of our research now is trying to adapt that approach, tinkering with glutamate, but can you do it in a safe manner? Can you retain the speed of onset, but make it safer to enhance ultimately these brain connections? And so thank you again for your support, and I'll leave it there.
So much to learn, and we'll learn more in the panel discussion as well. So Marie Albano, would you come up? And I mentioned among her areas of expertise are behavioral and cognitive therapies and anxiety disorder for children. So please share your findings and perspective with us.
Great. Thank you very much. Thank you all for having me here today, and it's a pleasure to be on the panel with these two guys who are fantastic and accomplished, and also to be here at Fountain House, which we have been interacting with for many years. And I do have to just disclose, too, that my husband is on your board of advisors for Mark Olson for the Medical Advisory Board, and have known of your work even before I started referring. So here we are. I want to tell a story just a little bit about this little girl who was afraid of many, many things. Doctors, so much so that her pediatrician had to hold her down at the age of 5, 6, 7, 8 every time to give her an injection, and in fact one time even slapped her across the face to get her to stay still while they gave her a booster shot. She would be inside the house on 4th of July and babysit everybody's kids from the neighborhood in the basement so that she didn't have to hear the firecrackers going off and such. Never went over to anybody's house who had a dog bigger than a teacup dog. And anyway, as they say in the field, research is me search. That is me. I'm nice to see where we are and where we can come. There is hope. One of the things that happened over time is, as I got into psychology, it just naturally became that I started working with children. And I think because research is me search, I got a sense of and understood the anxieties that they were coming in with. But at the same time, I also understood that there's a normal part of anxiety, and we have to understand that. We have to embrace the fact that anxiety is there to help us. It motivates little kids to want to run away from the doctor, but then the way that it's handled can help them to see, wait a minute, this is momentary, it's going to hurt for a minute, but then it's going to help you in a lot of ways, right? Anxiety helps us to study for tests so that we don't fail. Anxiety tells us to pay the bills as we're growing up so that our lights don't get shut off. All kinds of things. Anxiety is there for a reason. When we have about this much of it, we're doing okay. When it gets to be more than what we need, that's when it interferes in our lives. And the question is, why and when does that happen? So we've turned a lot of our attention over the years to understanding anxiety and its disorders. The one thing to know is it does start early, and I definitely had phobias, and we know that phobias, which many people think, so just avoid dogs. What's the difference? Oh, don't fly in an airplane, take a train, who cares? Well, actually, phobias start by the ages of 3 to 4, and phobias are the #1 disorder in childhood that predicts serious mental illnesses such as schizophrenia and bipolar depression in adulthood. So what does that say, okay? We call the anxiety disorders, as you heard, gateway disorders because they start first. Separation anxiety disorder by 6, 7, or 8 years of age, obsessive compulsive disorder by 10, social phobia is definitely there by 14, 15. They come on first, and they are gateways to depression by the time someone is 13 to 18 years of age, and then also to substance abuse. One of the things that we've learned, though, and my research has been in developing treatments, I had to figure out a way to overcome these anxieties. Okay, I will tell you that my mom, who I want to dedicate every talk I ever give to, I owe it to her. She took us from, my mom and dad moved us from Staten Island to Fort Lauderdale. I went through 8 years of Catholic school in Staten Island, moved to Fort Lauderdale, where I did not talk like anybody else, and they made fun of me for it. I didn't dress like these people. It was an unbelievably anxiety-producing event. And so they told me I had to go to school there, went to a Catholic school there, hated it, was made fun of from the first day when they still called out my name, and I said, "Here," and all that, all right? I went home crying, and Mom said, look, I said, I want to go back to Staten Island. I'll live at Mount Loretta, the orphanage. Get me there, put me back. And my mother was like, let me see what we could do. So every day, but you have to keep going to school because if I'm going to send you back there, you have to get in a good school. So you got to go so that, you know, they know that you mean to be a student. And every day I'd come home and it'd be like, well, I talked to the Monsignor back in Staten Island. He's working on it. A couple days later, I talked to Monsignor. He talked to the Cardinal. The Cardinal is working on it. A couple of days later. It was like my case was going to the Vatican, but we didn't, at this point, have cell phones or texting, so it was taking time. What happened is my mom actually was my first instructor in cognitive behavioral therapy because I'd come home each day and she'd say, tell me about your day. And I hate this and this person said that and I was made fun of. But what else happened? What else did you do? What did you learn? What might you do differently tomorrow? That's cognitive restructuring. She was getting me to think about, okay, these things happen, there's not good stuff going on all the time, but what can I do to make a change, to find my way through, to at least study and learn some things? Who were the nicer people who weren't making fun of me? And while that was happening, she was making me also keep going. That's called exposure. Now, I don't know if the Pope ever took up my case, but I do know that about 3 weeks in, 4 weeks in, I'm standing at the bus line one day, and a girl looks at me and says, you're not from here, are you? She's my best friend to this day, all right? And so exposures where we help youth and adults who have great difficulty with dealing with things that cause anxiety to be in contact with those things. And then, you know, to learn how to manage. And life's going to throw you a lot of curveballs. We know this. It's what you do with that. Not to avoid, not to escape. Escape and avoidance is the biggest thing that can bring us down. So what is important, and this is why I wrote the book too, is the family. Family is our primary context from which we learn how to be in the world. And I am a cognitive behaviorist, but Alfred Adler, famous analyst, said, you can love a child all you wish, but you must not make that child dependent. You must start from the very, very beginning. You owe it to your child to teach them how to be independent, because if you don't, if you are at their beck and call for everything they need all the time, you're giving the child a false sense of love. Very wise words to listen to, and this really this is what is the base of all the work that we do, is how to bring the family in. Our research has shown you can get children well who have anxiety disorders. We ran the largest clinical trial in the country, and we got kids well with a combination of medication and cognitive behavior therapy, and also the medication and the CBT alone treated them well. However, they will relapse over time. We unfortunately learned that. What we were missing, but we know we have to do, is also have the parents involved. And so our programs, even today, our kids are up to the age of 30 in our family-based programs, and that's why we interact with Fountain House, because again, too, we want the environment within which the kids are living and thriving to be there to support them. Family, and then also the community, such as what Fountain House presents to the children that come to them as young adults and such. So we've learned a lot over the years. Anxiety starts early, runs a chronic up and down course, can be a gateway, but there's also plenty of hope for people. Hope if they will have a community and a family that supports them to take on and face their fears. Thank you.
Thank you, Anne-Marie. Scott Stossel, please come up and help us understand your age of anxiety as well and share your experiences with us. And I know you're going to help us as well in our journeys. Thanks.
Excellent. Well, thank you, Consuela. So Dr. Matthew and Dr. Albano are here as the experts on the treatment of anxiety. I am here, unfortunately, as your resident expert on the experience of anxiety, specifically my own anxiety. I have pretty much all the species of anxieties that Dr. Matthew listed, and to be honest, I'm rather anxious right now. So it's a good thing I'm up here with a couple of mental health specialists. Actually, basically, you're all here for my therapy appointment, so thank you. Welcome. Therapy is expensive these days, but it's for a good cause. And actually, maybe you could have hooked me up to a ketamine infusion, would make this better. There really is a certain irony to my being up here today. I'm here because I've written a book about my anxiety, and part of that book is about my anxiety regarding public speaking in particular, and yet my reward, as it were, for having written about public speaking anxiety is to get to stand up here and do more public speaking. The other day I was actually talking to my therapist, my current therapist in Washington, D.C., about how nervous I was about this event, and he was trying to help me prepare. And so I showed him the Fountain House program, and he looks down and his eyes widened, and he says, wow, Fountain House. Oh, and Anne-Marie Albano, she's huge in my field of cognitive behavioral therapy. No wonder you're nervous. And then he looks up, and he sees me looking kind of stricken, and he goes, oh, sorry, that's probably the worst thing I could have said. I'm sure you'll be just fine. But then it turns out he says that he's a friend and colleague of Dr. Albano's, and so now I'm suspicious that this whole thing is an elaborate ploy designed to ratchet up the intensity of the exposure therapy he's been done with me. So nicely played, Dr. Holland and Dr. Albano. When my book came out five years ago, a frequent comment I got was a variant of, what a brave book, which I thought was kind of a perverse thing, because the only thing I'm brave about is admitting my lack of bravery. That is, what I feel I reveal is that I'm revealing is my weakness or cowardice. So when people would tell me that I was brave for coming out as anxious, what I would hear them saying is stupid. Because why would I choose to do what most people would have the common sense not to, which is revealing my vulnerability and weakness to the world? And I want to come back a bit to this idea of revealing vulnerability in a few minutes because it's important to my current mental health regimen. But first, let me tell you a little bit how I came to get interested in this subject and to write about anxiety. As I've said, I've been anxious my entire life. I've frozen mortifyingly on stage like this one at public lectures, and on several occasions have been compelled to run off. I've abandoned dates, walked out of exams, and had many breakdowns during job interviews, on plane rides, and train trips and car rides. I suffer from panic attacks. I worry a lot about everything. Sometimes this worry gets transmuted into physical discomfort like stomach aches, headaches, diffuse body pain, or a general malaise like I have mononucleosis. At various times I've developed anxiety-related difficulties breathing or swallowing, which are actually quite common. These difficulties then become obsessions, consuming all of my thinking. And I've also suffered at various times from a number of specific phobias, and to name a few, enclosed spaces, claustrophobia, heights, acrophobia, being trapped far from home, agoraphobia, germs, basilophobia, speaking in public, as I mentioned, which is a subcategory of social phobia. Flying is a big one, aerophobia. Vomiting, which is an unusual one, but that's emetophobia. And naturally, of course, fear of vomiting on airplanes, which is aeronausophobia. This all started at a young age. I was a shy kid prone to crying at the slightest provocation. And when I was in elementary school, I had terrible separation anxiety. If I was home with a babysitter, I would be abjectly terrified that my parents had died in a car crash or had abandoned me. And by age 7, I had worn grooves in the carpet of my bedroom with my relentless pacing, trying to just will my parents to come home. During first grade, I spent nearly every afternoon in the school nurse's office sick with psychosomatic headaches, begging to go home. By third grade, stomach aches had replaced headaches, but my daily trudge to the infirmary remained the same. On the only one, date that I had in high school, when the young lady leaned in for a kiss during a romantic moment, we were outside gazing at the constellations, I was overcome by anxiety and had to pull away for fear that I would throw up. My embarrassment was such that I stopped returning her phone calls. In short, I have since been, for years, been just a twitchy bundle of phobias and anxiety. And I've tried a ton of ways and different treatment modes to overcome anxiety, which I elaborate in my book. But what ultimately prompted me to write the book was an experience I had about 15 years ago when I was about to publish my first book, which had nothing to do about, the subject was not anxiety, it was a biography of Sergeant Shriver, who founded the Peace Corps. But I was seized by just absolutely terrible anxiety about the book tour because I was going to have to make public presentations. And my dread of the book tour was so severe that several months before it was to begin, I started having panic attacks if I even had to watch somebody else give a talk. So I was feeling desperate, and I sought help from multiple sources. And I went first to a prominent psychopharmacologist at Harvard. And he said, you have an anxiety disorder. Fortunately, this is highly treatable. We just need to get you properly medicated. And when I gave him my standard objections to reliance on medication, the worry about side effects and dependency, he resorted to the cliched but nonetheless potent diabetes argument, which goes something like this. Your anxiety has a biological, physiological, genetic basis. It is a medical illness like diabetes. If you were diabetic, you wouldn't have qualms about taking insulin, would you? And you wouldn't see your diabetes as a moral failing. And I had discussions like this with various psychiatrists over the years, and I'd always try to resist whatever the latest drug was, feeling that somehow this resistance was noble or moral, and that reliance on medication evinced weakness of character, and that my anxiety was an integral and worthwhile component of who I am, and that there was somehow redemption in suffering, until, inevitably, my anxiety would become so acute that I'd be willing to try anything and would go on another medication. So, as usual, I capitulated, and as the book tour loomed, I once again started on a course of benzodiazepines, basically Klonopin and Xanax, and elevated the dosage of the SSRI antidepressant I was already taking. But I was still terrified about the book tour, so I also went to the Center for Anxiety Disorders at Boston University, which specializes, as Anne-Marie does, in CBT, cognitive behavioral therapy. And there I was assigned to a young but highly regarded Stanford-trained psychologist. First thing we've got to do, she said, is get you off these drugs. A few sessions later, she offered to take my Xanax from me and lock it in a drawer in her desk. And she opened the drawer to show me where she deposited the pills of some of her other patients and actually held one up and shook it for effect. The drugs, she said, were a crutch that prevented me from truly experiencing and confronting my anxiety. And if I didn't expose myself to the raw experience of it, I would never learn that I could cope with it on my own. She was right, I knew. Exposure therapy is based on fully experiencing your anxiety, which is hard to do if you're taking anti-anxiety medications. But my fear was, with the book tour looming, what if I, in fact, couldn't cope with it? So I went back to Dr. Harvard and described the course of action that Dr. Stanford had proposed. And he said, it's your call, but your anxiety is clearly so deep-rooted in your biology that maybe the only way you'll be able to get to the point where any kind of behavioral therapy can begin to be effective is if you take the edge off the physical symptoms with drugs. So at my next session with Dr. Stanford, I told her I was afraid to give up my Xanax and related what Dr. Harvard had said. She looked like she was going to cry. I think she was betrayed. And so after that, I stopped telling her about my visits to Dr. Harvard. My continued consultations with him seemed illicit. Some months later, I read in the newspaper that Dr. Harvard was actually treating a depressed gorilla. I am not making this up, at the local zoo. Dr. Harvard's treatment of choice for the gorilla was Celexa, the same antidepressant he was prescribing for me. What to do? So on the one hand, Dr. Harvard was telling me that I, like the gorilla, had a medical problem in need of pharmaceutical intervention. On the other hand, Dr. Stanford was telling me that my problem was not principally biological, but rather cognitive. If I could simply correct dysfunctions in how I thought through cognitive reframing and direct exposure to my fears, my anxiety would be reduced. But the drugs, Dr. Stanford said, were impeding my ability to address those dysfunctions in an effective way. So I kept trying to cut down on my medication, and sometimes would succeed a little, but always ultimately I would be overwhelmed again with anxiety and would resort to miserably fumbling in my pockets looking for the Xanax. So as much as I would have liked to cure myself through fixing my thinking or acclimating my amygdala, I seemed always to be ending up like the depressed gorilla in need of chemical adjustments to my neurotransmitters to fix my anxious, broken brain. Anyway, the discrepancy in how these two very well-meaning, well-trained therapists approached my anxiety fascinated me and became fodder for my book, which is an exploration of sort of the rich array of genetic, cultural, upbringing factors that contribute to anxiety. I had a whole, anxious family, grandfather who spent a lot of time in McLean Hospital in Boston getting electroshock therapy. I also even think it's at a cultural level, like my dad's family is Jewish, my mother is a WASP, there's been no emotion or family issue that is better left unexpressed. So I realized that basically I'm Woody Allen trapped in John Calvin. So no wonder I'm anxious. Anyway, I just want to close. I mentioned a few minutes ago that when I said I worried that revealing myself as anxious was brave, and what they really meant was stupid, and that was a real thing. But the most gratifying thing about sharing my own story in book and in other venues has been hearing from a lot of people who said things to the effect of, it was like you were writing this book from inside my own head. Thank you for articulating what I feel. Actually, just as a side note, my favorite response was I got a note over Twitter from Paulina Porizkova, and those of you from the 80s know that she was a supermodel who was on the cover of my Sports Illustrated in 1984. And she'd read the book and said, "Oh my God, you helped me so much with my anxiety." And I was thinking, if I had known when I was 14 years old that the pinup model on my Sports Illustrated was going to write me a note telling me how much she liked my book, I think my anxiety would have been cured forever at that point. Anyway, a lot of people reported that the book made them feel better in ways that I confess I don't fully understand, because I'm definitely not cured of my anxiety, and I don't feel like a very credible authority for helping other people to transcend theirs. But some people, said that they felt inspired because I've managed to lead a mostly productive and functional life despite my sometimes acute anxiety, which of course provokes additional anxiety because I'm worried I need to hold it together because I don't want to let these people down by, falling apart. And in the book, I talk about what a former therapist of mine calls impression management, which is basically trying to project an aura of competence and confidence that was at odds with how I often feel inside. And I was very good at that. A lot of people, particularly with panic disorder and other forms of anxiety disorder, are good at that. But it comes at a psychic and actually physical cost. So by the time my anxiety book came out, the irony was I was having to rely much too heavily on things that weren't so good for me. Mainly alcohol, which I talk in my book is an incredibly effective method for dealing with different forms of short-term anxiety until it doesn't work, and then it becomes an absolute disaster. So after a bad experience with that, which is a story for a whole other day, I'm learning now to try to how to be okay with appearing anxious. And that may seem like a strange thing for a guy who's published a whole book on being anxious to say. You all know that I suffer from anxiety, but I still fear revealing it in the moment. And so the trick I'm trying to learn is to be okay if I were anxious up here and sweating or trembling or something, that I would be okay with it. And if I could be okay with that, the irony is the less likely I would actually be anxious. So anyway, I'm still medicated up here in order to be talking to you, but less heavily and more healthily than I used to be. I'm still anxious, but I manage mostly to muddle along. And I think the news is a good hope for me, and you've got these guys doing great treatment and research. So the future for people with anxiety disorders looks bright. Thank you.
Scott did that within the time allotted with a clock ticking in the background, so you can imagine it only adds to our deadline anxiety. So, there isn't anything that all of you have said that I think sorry. I don't think there's anything that has been said so far that all of us can't relate to. I think that, which is why anxiety disorder is the most widely diagnosed form of mental illness, and because it is so much a part of our lives. And the question is, when does it turn into something that needs to be treatable as a mental illness? So my first question to you, I was so fascinated by the fact that it starts so young. And so Anne-Marie, let me ask you the first question is that, so if it starts at age 3 or 4, and as you said, your me research, I can't believe you were that little girl that you described looking at you today. But what do you do? Because kids do have phobias and they get scared. So, when do you intervene? When do you really take note of it and say this could develop into a problem?
Well, this is an excellent question, and what we're struggling with in the field, the answer is it's never too early. It's how to do things, how to intervene. So one of the things to know, for example, and I will again reference my husband's work, which shows that he studies patterns of how we treat people in this country with mental health conditions. And what he has shown in his work is that children between the ages of 3 to 7 years of age with anxiety, tantrums, so behavioral problems, ADHD, as well as autism spectrum, are being prescribed in higher and higher rates over the past 12, 14 years, antipsychotic medications. Antipsychotic medications in 3 to 7-year-olds, boys more than girls, in the absence of having a mental health visit in the prior year. So think about that. So what essentially is we need to do, because anxiety does start early, as we said, and we can't just say it's a phase that your child needs to sleep with you every night. It's a phase that your child doesn't want to go to school. It's not just a phase that kids are going to work their way through. There are family-based interventions, parent-child interaction therapy, parents management training, that we can give to families and teach them to do so that maybe we prevent having to use medication, or at least delay the start of, especially these medications where we don't have any science behind what happens to the child who receives them. So we've got to get the families involved early. And probably some of the ways to do that is by locating services in pediatrics clinics as well as in schools and community settings where families can reach and make time to go to.
And Sanjay, and listening to Scott's story of all of the different therapies that he went through is just, it's kind of cut to the chase. What if you had been seeing Scott, for instance, what would you have advised that he do? I mean, what do you think? And I'll ask him personally, what was the most effective? But how do you handle this? Because it just sounded like a nightmare of what he was going through.
And unfortunately, what Scott experienced is often the norm. And the type of treatment you end up getting is often a function of a person's training or what type of clinic you go to. So it's really interesting, even at our university clinic, we have a clinic run by the psychiatry trainees and another one run by the psychology trainees. And so the exact same patient, depending on where they're sent, will leave the first appointment with a prescription for Prozac or a prescription for a 9-week course of CBT, cognitive behavioral therapy. So it is really a dilemma, and it shouldn't be that way, that the treatment is purely a function of the specialty of whoever you're seeing. And I think that's where primary care plays an important role. And psychoeducation plays a really important role.
So, Anne-Marie, do you want to follow up on that? I mean, I can't believe that that's still the case, that you're getting these conflicting.
Well, again,
professional
the other thing
advice.
To know, though, is that in our clinics, because we're in major medical centers in the regions where we work, for the most part, though, in the community, folks are not getting medication or CBT per se, at least not evidence-based, okay? So most prescriptions in the country are being written by primary care docs without mental health following up. the effective therapies, with it's not just CBT, but there's interpersonal psychotherapy, functional family therapy. There's a range of therapies that can be very helpful, but these evidence-based treatments are not in the community mental health settings. And for the most part, supportive care is in the community. So we do need to train the workforce to be more, to have a wider range at their disposal of whatever their specialization is, social work, psychology, psychiatry. But I think the first thing to do is to listen to the patient. Mm-hmm. Don't jump to a prescription or jump to give me your pills and you start to challenge your thoughts. No, let me hear your story. Let me listen to you and understand you, and then we collaborate together on what's going to be helpful, and we'll figure out what's helpful.
Sanjay.
Yeah, I just wanted to add one thing to listening to this story. Unfortunately, a lot of the systems of care limit the intake appointment, believe it or not, to 30 minutes, right? I mean, I can barely say hello and an introduction in 30 minutes. And so there's really that time pressure which doesn't allow the system to work. Right. Because taking the history is the most important thing. We have limited lab tests, as you know, very few biomarkers. MRI is not something we use in clinical practice. And so it really comes down to careful history.
And Scott, fast forward to where you are today, if you could go back and, redo your journey of treatment, what would you be emphasizing? And what do you wish that you could have had access to early on?
That's a good question. I mean, what has been most effective to me, for me over the years, and what I think is most effective for other people based on the literature that I read, is cognitive behavioral therapy. There is a lot of research suggesting that is effective for not just anxiety, but depression and other things too. And the benefit, and it's not perfect and it doesn't work for everybody, but the benefits of it, the treatment, the outcome results as I've seen them are, equivalent oftentimes to medications, but without the risks of side effects, long-term dependence, all those kinds of things. So I do feel like if you can do, CBT. Also lately, and I still suck at it, but mindfulness is a big part of what therapists who work with CBT and with exposure are doing. And again, it's a combination of, with CBT, you're exposing yourself to the things that make you anxious, learning that you can tolerate them, learning how to reframe your thoughts around shame and sort of inefficacy. Mindfulness is sort of letting you just calm your body, but being more in tune with what you're feeling. And then exposure is obviously directly exposing yourself to that. My views on medication are incredibly complex, and I try to keep them simple here. I mean, there is a large and reasonably reputable body of critics and literature sort of talking about how psychiatric medication of the last, depending on 20 or 75 years, is a confection of big pharma that is out to make a ton of money. I think there's a tiny grain of truth to that. I also think there's a lot of there's some big, large-scale meta-studies about that some of the most famous, widely prescribed antidepressants are maybe only as effective as placebo or barely more so. All that stuff gives me pause and wondering about, are these really effective? That said, I have been taking them and continue to take them for 30 years, and they definitely work in some circumstances at some time. So there are, I think sometimes bad medications get prescribed, and I've had some bad medication things going back to when I was 12, and then a few years ago when I got put on a drug that made me gain 20 pounds and made me much more anxious. But that's part of the standard protocols in some ways of nobody knows it's hard to tell, even though they have genetic research that you can sometimes have some indication that this drug will work better for this patient. For the most part, it's a little bit trial and error. So as a patient, you can feel a bit like a guinea pig, like, well, let's throw this at the wall and see what's happening. And okay, I'll keep taking that, and then, well, I can't, I'm having this side effect. Okay, stop, take this one. All that said, I am not against medication. So
how do you, once you have been diagnosed, Sanjay and Marie, with an anxiety disorder, is it something that is chronic? Is it something that you can that you're going to have to live with for the rest of your lives? Are there episodic anxiety disorder diagnoses? So just help us kind of understand the course of the disease.
Yeah, I think, I mean, for some patients, this will be a chronic picture where they'll have this for many years, many decades, but for many others, they'll have a single isolated episode, perhaps in college, perhaps in high school, and they fully recover, and they never have to see a therapist again. So I always emphasize that we don't know which way this will go, and we have to keep in close contact, but after a period of time, if you're completely free of symptoms, we don't need to maintain the treatment, right? If you've learned something in CBT, you may come back for booster sessions, but after you finished your course of medication, there's no reason for you to be on this for life.
So I want to say that for me, working in our clinic where we do start at the age of 3 with families, and we go all the way up, it's 3 to 30 is really our age group. What I consider a success are the children that we have seen that come in, we work with them and their families, identifying goals, and one of the things I will say is family has to be involved. I rail against any therapists who lock families out of treatment and don't connect with families, even with my young adults. I have an agreement with the young adults on talking with mom and dad and what's confidential and what isn't. And I'm sorry, especially when someone's paying the bill for therapy, I don't believe that, you know, when kids are dependent in their 20s, that the parents shouldn't be involved in some way in goal setting and working together on developmental milestones. But I consider a success when our young kids down the line pick up the phone and call and say, Dr. Albano, I saw you for separation anxiety when I was 10. I just graduated from X school and I'm about to start a job and I'm falling apart. I don't know what to do. That to me is taking, sure, anxiety could reappear, especially at times of stress and changes in development and tasks, but at the same time, that's someone who has learned it's okay to get help, and to get help, you know, as soon as you can, and to make use of these services that we know that can be helpful to you, and especially if you're going to be a person who is more inclined to be anxious than not. So that's where I see the course going.
And the esketamine, the ketamine that we discussed, but the drug is esketamine, is, you talked about the kind of the new research, the new approaches that you're doing. Are those, and that is specifically for treatment-resistant depression, is my understanding, but are there new drugs on the horizon for anxiety disorders that are going to be equally as effective and fast-acting?
Yeah. There are a couple drugs in development that are working on the glutamate system more broadly, and the idea is to enhance neuroplasticity. And neuroplasticity essentially means the ability to grow and change. And if it sounds like a great thing for brain cells to be able to do, we know that neurodegenerative disorders, such as Alzheimer's disease and so on, can be marked by loss of specific neuron cells and loss of resilience. And so enhancing neuroresilience is where some of these drugs are acting. That's the hope.
Right, and so in my age of anxiety, I think, you know, the last part of the title is about, you know, finding peace of mind. Have you found peace of mind?
My mind is more peaceful than it once was. I mean, again, Marie says, I mean, it's subject to external stressors. I have gotten better at knowing what I need to do in my life to reduce exposure to those stressors and to kind of wrap myself in the necessary bubble wrap to mitigate them. And it's simple. I mean, partly it's the medication, but it's not overstretching myself. And then these are the things that your grandmother would tell you, but are really, really important. Get enough sleep. You know, the more sleep deprived I am, the more susceptible to severe anxiety I am. For me, getting regular exercise, not just as a kind of bulwark against anxiety, but just it boosts my general sense of well-being. And there are a lot of studies about that, you know, real, you know, controlled studies that show that that's effective. As I said, trying to be more healthy in how I approach the use of certain other things that I was using that to manage my anxiety that worked very well in the short term, but that were compounding the problem with dependence and addiction. So that's a long-winded way of saying sort of.
And Anne-Marie, I'm looking, and I was just looking anxiously for the titles of the books as well, your book, because it's, and it was, as I said, You and Your Anxious Child, Free Your Child from Fears and Worries and Create a Joyful Family Life. So is it possible to free your child and, the inner child in all of us, to free ourselves from fears and worries? And lead a joyful life. That Create a Joyful Family really resonated with me.
I think one of the reasons I wrote the book, one was because what we saw was parents early on. I mean, if I ask you right now, everybody rose their, you raised your hands about knowing anxiety in your family or in friends. Think about the first time you saw maybe your child struggling with something they were afraid of, being rejected on a playground, feeling bad about being afraid of a dog coming, but whatever it might have been. Think about that first time you saw your child afraid and shaking. What was your experience of that? Now, when I run my parent group in the first session and we talk about this, A, they're talking about 3, 4, 5, 6-year-olds, and B, they're talking about, I just wanted to fix it. I wanted to comfort them. As parents, we comfort, we protect, we reassure, we fix the problem for our kids. The thing that we have to help parents and families to do is to be there to be coaches or mentors, not to be the fixers, but help your child learn how to manage. So kind of like mom, go to school, see how it goes, to get into the situation. This is what's important. When that happens, your child learns how to master a bit more of the situation. It might not be perfect, but the other thing is you won't be the parents that I have in my parents of adult children group who love their children very much but now are very resentful, upset. They're doing everything still and they don't know how to get disentangled from that. So we have to be very careful of that balance. You can have a joyful family life if your child learns to self-soothe, to be a bit more assertive, to know what to manage and how, and if you too can take care of yourselves as parents.
So I'm going to ask each of the panelists, and I think, Anne-Marie, you might have just given us the final question before we are served our lunch. And that is, if you could leave us with one thought. Sanjay, I'll start with you, or insight about anxiety disorders. Just one thought, what would it be?
Yeah, I mean, my thought is that there's great hope. And I look at the future in terms of how much we know about the science and the medicine, and it's just astronomical how much we've learned in the last 10 years. And so my final thought is just there's a lot of hope.
Oh, that's great. Anne-Marie.
Everyone has it. You're not alone.
And Scott.
I'll merge what they both said. Every conference I go to talks about how anxiety disorders in particular are among the most treatable of the emotional disorders, and that there are various forms of hope further down the line. It is also a normal human evolutionary adaptation. If we weren't anxious at all, we'd be playing on the edge of cliffs and falling off, and the species would have died out. So it's just a matter of harnessing it in adaptive ways and learning to manage it as part of being human.
Thank you all so much for your contribution to your work. And this is a special moment in Fountain House's history. It is a milestone. I will say it's an anxiety-inducing one for many of us, because Fountain House's president, leader, our rock for 27 years, has decided to retire. It's a long-planned retirement. For those of you who haven't had the great fortune to know Ken Dudek, this film is going to provide an introduction, and so we are now going to watch a film about him and Fountain House.
Walking in Fountain House was finding something I never imagined ever actually could exist. It was a warm and vibrant community full of humor and hope, and it was a miracle.
A community where people can grow, recover from their illness, and move forward with their lives.
There's no place like Fountain House.
It's just a place you want to come. It makes you want to be here, you know?
Ken and I came to Fountain House around the same time, about 28 years ago or so. He's a truly dedicated leader. I think he's just done some tremendous things and has had a great vision.
Ken's creativity, I think, has been behind a lot of the initiatives that have worked.
The Wellness Unit was created, a state-of-the-art program which focused on nutrition.
The Wellness Center has been a real eye-opener because a lot of people with mental health don't do well physically.
So under Ken's leadership, one other program that was developed is the College Reentry Program.
What is available to the young person who drops out of college is a program that really supports them.
And get them back to really be able to study again, to get their education, and to move forward with their lives.
I believe that this place was built to restore lives, and part of the treatment is working. We are trying to build our own businesses outside this building to give members more work.
I work at a Fountain House job. I'm a peer counselor / studio assistant for this studio in Queens that is the place where artists make their work.
Under Ken's leadership, there used to be an old thrift shop, and just the brilliant idea of converting that thrift shop into an art gallery, where literally hundreds of Fountain House members over the years have been doing some incredible artwork.
The housing program is a result of the obvious fact that you can't heal if you're not housed and fed.
Our housing for me is amazing because I had been in Rockland State Hospital for 3 months. I had had a really bad breakdown. And then luckily I was on this waiting list. I got into this residence and it's a 1-bedroom. It's marvelous. It's my own place. I got stability. I haven't been in the hospital since.
When I was having my daughter, Ken made sure I got a bed for my daughter. And you know, I look at things like that.
Ken realized that what we have here imposes on us a moral imperative to share what we have learned, what we have gathered from our membership, and to really show the world what is possible. Thanks to Fountain House's stature in the world, starting with the Hilton Humanitarian Award, our relationship with the World Health Organization, and most recently our international conference, Fountain House is now clearly recognized as one of the leading authorities when it comes to the treatment of serious and persistent mental illness. The Clubhouse model has been replicated hundreds and hundreds of times around the world,
Affecting really astonishing change in people's lives.
You really want to know about Ken, huh? Okay. That man saved me. I came in here, I was 0. I mean, 0, flat out, already written off by society. Oh, he's headed back to prison, or he's gonna die on the streets. He is the only reason that I'm sitting in front of you today, successful in Fountain House. The only is because of him, man. I really love that man.
He done created so many different jobs, so many different buildings, so many different places for people to live, for members to live. His kindness toward everyone, and also the way he's taking care of people. He's a very fine gentleman.
He's always accessible, he's always friendly, he's always got a sense of humor.
Ken sees the humor in anything where there's humor, which is most things, actually.
He's got this air, this presence of respectability, so you actually trust him to do the best for the house.
I can only say that he is tremendously loved, and I know he's going to be tremendously missed.
Ken was one of those people who really did see what could be done, what was possible, and I think that was and is his genius.
Ladies and gentlemen, Ken Dudek.
Thank you all. You know, I told them I hadn't seen this film before, and I told them this was really bad timing. I said, I'm going to see this film, and then I'm supposed to say a few words, but I'm going to do that right now anyhow. It has been an honor and a privilege to partner with all of you for the past 27 years. We've had a major impact on the way people think about mental illness and the people who experience it. Fountain House will continue to strive to make people's lives better all over the world. And I want to thank all of you for the contributions that you have made to our effort, and thank you again for today. The shortest speech of the day. So, a little segue here for just a second. This year, Fountain House is presenting its first award for excellence in broadcast journalism, which recognizes members of the press who tell the story of people living with mental illness fairly and with dignity. Not only did today's recipient, Elizabeth Vargas, courageously share her own struggles with anxiety, and she actually shared her anxiety with me just a minute ago. Together, we shared anxiety. Okay, so Ann said my sense. So basically, the anxiety of the speakers increased my anxiety, and I don't usually have anxiety when I speak publicly. So I want to thank you all for that. Anyway, back to Elizabeth Vargas, who's Elizabeth courageously shared her own struggles with anxiety, but she's also consistently demonstrated empathy and integrity when discussing the topic of mental illness. It is with a great pleasure that I present the Award for Excellence in Broadcast Journalism to the host of A&E Investigates, Elizabeth Vargas.
Thank you so much. It feels extra special to be getting this award from Ken after his long and storied and stellar leadership of this incredible organization. It's really was very moving just now. I was tearing up over there watching the film, and I just met Ken, so I can only imagine what all of you are doing. It's really an honor to be here and to be talking in a room full of people like this and hearing other people talk so honestly and openly about anxiety. It's something I have lived with my entire life. I'm an Army brat. My dad was in the military for 30 years, and I grew up on Army bases, moving around every year or two my whole life. And I had absolutely no words for that, the anxiety and the panic attacks, the enormous separation anxiety. My father went to Vietnam when I was just 6, and I had panic attacks every single day that he was gone. And I never told a soul. I never told a soul. You know, the military wasn't helping the Vietnam vets coming home with PTSD. They certainly weren't paying any attention to the soldiers' children. And I grew up thinking that this was just me, that I was the only person in the world who felt this way, and that there must be something wrong with me. I was deeply ashamed of my own fear, and I literally white-knuckled my way through childhood and adolescence. And then I did have a therapist recently ask me, and how did somebody as anxious as you end up on national television with an audience of 15 million people? The point is, I was able to hide it. I hid it really well. And I think a lot of us who suffer look around and think everybody else looks okay, I must be the only one. And it's really important for those of us who do suffer from anxiety to talk about it more. The statistics are unbelievable, we've just seen. And in my case, you heard Scott Stossel talk about this. Many people who are anxious use alcohol to help them feel better. And I self-medicated with alcohol to the point where it became absolutely destructive in my life. 60% of women who are alcoholics suffer from anxiety. There is an enormous link between anxiety and alcoholism in women. It's about 30% for men. And until we start talking about issues like anxiety, issues like addiction, people will suffer in silence and won't get help. Only 1 in 10 people in this country with an addiction disorder get help. That means 90% of people who need help don't get it. And that's why I wrote my book. I was outed when I went to rehab for treatment for my alcoholism and my anxiety, and it was devastating, I won't lie to you. Devastating to have something so personal and painful be suddenly so public. But once I got home and struggled through those early days, weeks, months, even years of sobriety, I realized one of the reasons I didn't get help was because I was so ashamed and so afraid of putting my hand up and saying I'm suffering. And I fully embraced the stigma around the disease of addiction, the stigma around being vulnerable enough to say I'm feeling anxious. And that maybe if I wrote this book, maybe it would lead to some other people getting help. I'm gratified to say that literally every single day since that book came out several years ago, I hear from somebody who say that they got help or were able to better understand somebody in their life who suffered from either anxiety or addiction to alcohol. I just gave a speech on Friday in Purdue University to 2,000 women and sat there for 2 hours signing books afterwards, and nearly every single woman, it was mostly women, that audience, said they had their own story. So the good news is that with an extraordinary panel like this, and by the way, this luncheon is so cool. This is my first time here, and if every luncheon is this great, I'd love to come back. It's a really great, I mean, that was an extraordinary panel and an extraordinary discussion on a topic nobody talks about. So anyway, it's a great honor to be here, a great honor to get this honor, and I just want to salute the Fountain House for the extraordinary work it does. That video was so moving to see the difference this organization is making in the lives of these people, and the difference you, all of you in this room, are making by your support of the organization. So thank you so very much.
I wasn't tasked with talking about my anxiety, but I already feel cathartic after this lunch. I'm here really to do something special, and it gives me a great pleasure today to present today's Fountain House Humanitarian Award to a true living legend, singer and songwriter Judy Collins. She has reached the highest pinnacles of creative success, including gold and platinum status, Grammy nominations, and top 10 hits. But even as one of the most accomplished artists of our time, Judy has faced adversity. Her best-selling novel, Sanity and Grace, she focuses on the tragic loss of her son to suicide. Judy has courageously broken down barriers for others by sharing her own battle with alcoholism and depression. And as such, she has provided hope and inspiration to millions of people. Please join me in welcoming an icon, Judy Collins, the 2019 Fountain House Humanitarian Award recipient.
Thank you. I am so impressed with this group of people and the things that you talk about and think about and work on. I don't know that there's one of us who hasn't suffered some of these really debilitating and crippling anxieties and fears, and some of us addictions. I have written about them extensively. Once I opened my mouth, I just couldn't shut up. You know, I was raised in an alcoholic family. I had my first actual suicide attempt at 14. Before that, I had been diagnosed with migraines, and most of the doctors in Denver saw me when I was diagnosed with migraines, and they talked about it, and they worked on me, they looked me over. But when I tried to kill myself, nobody was there, because it's a secret, of course, as we know. It was a secret, terrible secret. Somehow, because of that and because of where I come from, and you know, my father was an alcoholic, active alcoholic, but I learned from him a lot of things, of course about music, of course about literature, of course about showing up and doing your job, no matter whether you're drunk or anxious or not. And of course, the self-medicating with the alcohol came with the birthright, with the birth certificate, and with the genes and the way we look. Many of us seem to have it. And because thank God I got into therapy when I was, I knew I was an alcoholic, there's no question about that. I knew when I was 19 because I felt that hole in my heart. And so I got into a group of therapists in New York. Maybe you know about them. They were called the Sullivanians. I want to thank our panel because it was a vivid picture of what's possible and what has to be done. And I liked the theme of hope at the end. You were just amazing, Anne-Marie, just amazing. And so were your partners. I'm impressed and just informed even more today. But when I started to be in this therapy, I went to these therapists because they were, of course, there, and I was desperate. And also they said, you know, if you have some problem with anxiety, and if you have some issues with being nervous or anxious, just have a few drinks. And so I stayed for 15 years. And then, of course, have been privileged to see the recovery of many of my friends and family, but of course the horror of watching my son take his life. I was saying to my dinner partner, my luncheon partner, that there's only one thing to do when you've lost someone to suicide, and that's to find a way not to kill yourself a day at a time. How you do that is complicated, but I was lucky and fortunate, and I was married to a man who was extremely, unbelievably stuck with me and went through that with me. I also have been fortunate because my own journey has included almost dying from alcoholism and finding AA. I will say that AA saved my life and does every day of my life. I'll never not go to meetings, never not go to meetings. I celebrated 41 years just a few days ago. Now, the truth is there are many, many ways to look at this and many ways to think about it. But the main thing is we're talking about it, that everybody here can say something in public. They can say something to a dinner party instead of saying nothing, which was so horrible. To say nothing. The silence is what kills. The silence is what destroys us. And being able to be out in the world where there is hope, where there are many choices, and where there are things that can do for you and for your family. I know it's a family illness. All of them are family illnesses. And they come from the behavior, from the things we didn't know. And now, of course, in the joy of sobriety and of fellowship and of openness and transparency, we can share these ideas one with the other. And I'll just share one thing with you, which is rose and flows of angel hair and ice cream castles in the air, feathered canyons everywhere. I've looked at clouds that way, and now they only block the sun. They rain and snow on everyone. So many things I would have done, but clouds got in my way. I've looked at clouds from both sides now, from up and down, and still somehow it's clouds' illusions I recall. I really don't know clouds at all. Thank you for the honor. Thank you so much.
Thank you, Judy and Elizabeth. You're an inspiration to all of us. I want to express my gratitude to everyone here for supporting the Fountain House Symposium and Luncheon. I am pleased to share that today's event was the most successful ever, raising well over $1 million. We look forward to seeing you again next year. The date is Monday, May 4th, 2020. Please save the date. Enjoy the rest of the afternoon.